Telepresence robots are a form of telepractice that can be used in a variety of healthcare settings, such as hospitals, clinics, assisted living centers, and more. These robots can be used in an interdisciplinary way to interact with patients. Telepresence robots enable healthcare settings and providers to connect patients to specialists and other providers who may not be readily accessible. This video is an example of a psychiatric mental health evaluation conducted remotely by a specialist through the telepresence robot. While this video highlights the use of a telepresence robot, keep in mind that there are many modes to conduct a telehealth visit, such as a virtual platform on a tablet. However, whether you are using a robot or a tablet, the key elements to conducting a successful telehealth visit remain the same. In this video, you will observe some basic tips for rapport building, an example of orienting the patient to a telepractice visit through introductions, obtaining the history of prior psychiatric medication trials and responses, as well as a history of symptoms. You will also learn how to assess the patient's current stressors and supports. And lastly, how to conclude a visit with an agreed upon plan of care by summarizing the plan and providing space for patient questions.
Hi there, do you prefer to be called Allison or do you have another preferred name?
Allison's fine. Thank you.
Great. Yeah, absolutely. So Allison, it's really nice to meet you. As I mentioned, I'm Sarah. I'm a psychiatric mental health nurse practitioner. So basically, I just want to spend some time with you asking you some questions and getting a better sense of your background so we can come up with a plan to, better treat your depression and help you get feeling better soon, okay?
Okay, sounds good.
So I know that Dr. Frost said you're on 75 milligrams of Zoloft and you took some other medications in the past. Do you remember what you had taken before?
Yeah, I took Wellbutrin in the past. That gave me some anxiety. I didn't do great on that one. I've been on Prozac in the past as well. I took that in my college years. And then during my pregnancy with my daughter, my doctor switched me to Zoloft. And that was the first time I had been on that. And then that's what I'm on now. I've probably had the most success with Lexapro. And I was on that when I was a teenager, but my insurance lapsed at the time and I ended up being put on something else.
And the Prozac, did that seem to work well for you?
It didn't really do that much for me. I had some success with it, but really not much of an impact.
Okay. So it sounds like your OB switched you to the Zoloft during pregnancy and you've been on the current dose for several months, correct?
Yes.
Okay, but it doesn't seem to be targeting the depression symptoms very well.
No, it seems to just be kind of the same. I've been very fatigued. I've been, having some anxiety and just feeling very run down. And I feel like it's more than just the new mommy stuff. I feel like it's, a real fatigue and maybe a depression fatigue that I'm experiencing.
Mm-hmm. Absolutely. And like you said, this is your third child. So you certainly know kind of what's that new norm, new mom norm versus what's maybe more than that. How long have you been struggling with depression for, Allison?
Since I was a teenager, my mother had passed away and I had been diagnosed with depression in my teenage years. So I've been managing it for quite a long time now. And I feel like I've managed it pretty well during my pregnancies. I've kind of, learned to judge my body and know how I'm feeling and things like that. So I feel like I've managed it pretty well up until this point.
Okay. So you felt a bit better during the pregnancy, but since you've had your daughter, since you've been postpartum, you've noticed the depression has increased?
Yes.
Okay. And did you have postpartum depression with your other two children?
No, I did not.
Okay. Are you currently in therapy at all, or have you been in therapy in the past?
I'm not currently in therapy. I did see someone a few years ago, and she was great. I had a very good relationship with her. She was awesome. But that was another time that my insurance changed. My insurance lapsed at that time, so I was no longer able to see that person once I got a new insurance policy. She didn't take my insurance.
Okay, that's so hard. And I'm sure it sounds like a nice idea now, but maybe hard to imagine fitting in when you have 3 young children at home.
Yes, I'm sure that it would be a positive experience for me. I've had, good luck in the past, but it's been hard to prioritize myself, with having young kids and then with COVID going on and things being closed. I've really struggled the past few months with those limitations.
Yeah, absolutely. It's good that you're here though, and taking the step to take care of yourself and getting your depression better treated. It's important, not just for you, but your kids and your family too. So do you have anyone who can help you out with the children? Do you have support at home? Who lives at home?
I live with my husband. He's been working from home during COVID, so I have had to take on a few more care responsibilities. But my mother-in-law is very helpful. She comes a few days a week to help out with the kids. She also will come anytime I need to go grocery shopping or have appointments or things like that. So she's been wonderful.
That's great. I'm glad she's been able to help and support you during this time. And how has it been trying to connect with friends, especially during this time of COVID? I know being a mom to a newborn can be isolating enough, let alone throwing in a pandemic. So how has that been for you?
Pretty difficult. I still have some friends that I can talk to, but I haven't been able to see people. And with my other 2 kids, I went to those new mommy classes, and that was really helpful at the time to give me some socialization. And I know that new moms can feel isolated, but during COVID, it's just a new type of isolation that I've never felt before.
Yeah, absolutely. And do you feel like that's also contributing to the depression you're experiencing?
I feel like it is because I can't go out as much as I could, or I'm limited on what I'm able to do. So I do find that to be a new challenge.
Yeah, absolutely. Have you had any significant struggles with anxiety at all, Allison, or panic attacks, anything like that?
Not really. When I was on the Wellbutrin, I did, as I said, experience some anxiety with that, but otherwise, no, not really.
All right. Is there anything else that we haven't talked about that you feel is important for me to know in terms of your history or what's been going on for you recently?
No, not that I can think of.
Okay, great. Well, thank you for bearing with me. I know I asked a lot of questions. These appointments can certainly be draining, but I'd love to chat a little bit more about a plan for treatment moving forward. So one thing I think that would be good to get back in is getting you back in to see a therapist. Hopefully with so many people offering telehealth, that might make it more accessible for you. I don't know if your mother-in-law might be able to watch the children, maybe for you to attend appointments on a regular basis, if that might be an option.
I believe she would. Yeah, she's been, as I said, she's been great. So I know she's been really flexible, here and there when I need to go grocery shopping. I'm sure if I had a regular scheduled time, she could definitely work with me on that. So I will reach out to her.
Okay, excellent. Yeah, so at the end of your appointment, what I'll do is I'll give you a list of some therapists I recommend and work with frequently who take your insurance, and then you can look into them further and see whose availability might work well with you. And I think that'll be an important aspect of your treatment in addition to a medication adjustment.
Great, okay. Thank you.
Yeah. So it sounds like the Zoloft, you've been on it for long enough that we would hope to see some improvement, but we haven't. And where you did well on the Lexapro before, I think it would probably make sense to switch you from the Zoloft back to the Lexapro. Do you happen to remember what dose of Lexapro you took when you were on it as a teenager?
I think I might have taken 10 milligrams.
Okay.
But I'm not entirely sure. It was a while ago.
You're probably right. It's typically dosed at either 10 or 20 milligrams. So I think what we'll do is decrease your Zoloft dose gradually and then get you back started on a low dose of the Lexapro and titrate you up to a dose of 10 milligrams to start and give that some time to kick in. And I think in combination with getting you back into therapy, that should be helpful. And I will consult with Dr. Frost to let her know what we came up with. And you can certainly follow up with her. And if things aren't going the way we expect with the plan, I'm more than happy to meet with you again and consult about further changes or ideas. Okay?
Okay, thank you.
Yeah. Do you have any questions for me at all, Allison?
No, I don't.
Okay. Well, it was really nice to meet you. Thank you for taking the time to talk with me. And I feel optimistic that the changes we're making will be helpful for you.
Great, thanks a lot.
You're welcome. Take care.
In this video, we reviewed some basic tips for rapport building during a telepractice visit through orienting the patient to the visit, obtaining a prior history of psychiatric medication trials and responses, as well as a history of symptoms, assessing the patient's current stressors and supports, and finally, how to conclude a visit with a mutually agreed upon plan of care by summarizing the plan and providing space for patient questions.